I'm Zoe Jones. I'm a cardiologist and I work with Central Georgia Heart Center. I graduated from high school in Macon, Georgia, went to Smith College in Massachusetts, and then to Columbia University where I got my master's degree. Then I went to medical school in New York City at Cornell University Medical College. After that, I did my internal medicine training at Einstein and also in New York City in the Bronx, and then went to St. Luke's Hospital for cardiology training. So after training, the question was where to practice, and Macon, Georgia already had a very good cardiology program set up, and came back to Macon partly to be with my family, but also because it was an excellent place to practice even back when I returned, which was in the 1980s. Central Georgia Heart Center has been committed to taking care of patients in a timely manner and also with the best expertise that could be provided anywhere in the United States, in the world. I came to Central Georgia Heart Center in 1997 because I wanted to help provide interventional services to the people of this community. We were very committed to providing those services, to working with our referring doctors, to helping them. If they called up one morning, we were ready to take care of their patients that afternoon. It became a larger practice during the course of our working together. When I came back to Macon to practice, I was the first cardiologist woman in town. And I was the first cardiologist, in fact, who had trained doing balloon procedures. They were very new procedures back then. All of the people who we have brought into the practice had similar expertise and commitment to patient care. The physicians at Central Georgia Heart Center are committed to patient care, but a part of that patient care has been providing interventional services to the patients. As a cardiologist, I get to practice what I enjoy doing. I continue to practice medicine because of the satisfaction that it gives me, the satisfaction to see what I can do to help patients. I am an interventionalist. What that means is that people who have blockages in their heart arteries, I can take a balloon catheter or a stent catheter and open up the blockage, and the patient then is free of all of the symptoms that they were having, such as chest pain, sometimes shortness of breath caused by these blockages. So I'm an interventional cardiologist, meaning that I'm working on the heart arteries. And also, I enjoy it. I enjoy treating patients. I enjoy procedures. I enjoy the people that I work with. The balloon procedure is one where we put a catheter with a balloon on it down into an artery. The artery has a blockage, and when we inflate the balloon, it opens up that blockage. Over the years, we've developed a lot of things new since when I first practiced. We put in stents that weren't available. We have stents that have a drug coating on it that keep them from clogging back up. And we have other procedures, too, that help to open these arteries up that we never would have even imagined we could have worked on back when I first started. Working with our referring physicians has been very important. If it wasn't for the referring physician, we would never see the patient. Patients sometimes say to me, "Dr. Jones, thank you for saving my life." And I say to them, well, if Dr. Smith had not sent you, I would never have been able to do anything to help you. We feel like it is a team, and we all need to work together as a team. Throughout my years in practice, my primary focus has been and continues to be the patient.